Hello everyone. So today I'll be demonstrating a visualization that I created on the percentage population of adults reporting serious thoughts of suicide in the United States and the population of adults who were untreated and were diagnosed with mental health. So mental health is a critical aspect of overall well-being and affects millions of individuals across the United States. Despite its importance, the access to mental health care remains a challenge in many areas and it has been a serious issue of concern. In recent years, the suicide rates have been constantly increasing all over and also in United States. So it becomes important to do a study in this. So in this notebook, I aim to shed light on the prevalence of suicidal thoughts among the adult population in the United States across all across all the states in US. And also, I did a visualization in which it shows the percentage population of adults who were diagnosed with mental health treatment but they were untreated. This could be helpful for healthcare professionals, policymakers, and researchers to get a better understanding of mental health landscape in the country. So this is a visualization which shows the adults with serious thoughts of suicide, and this is a visualization which shows that adults with mental illness who did not receive treatment in the year 2022. So my main insights were that the Alaska and Utah reported the highest percentage of adult population who had suicidal thoughts, which was approximately 6% of adults in both the states. More than 6% of adults in both the states reported suicidal thoughts. And it was followed by Wyoming, Colorado, Indiana, and Ohio with population over 5.5% of adult population who reported serious thoughts of suicide. And the lowest were Texas and North Carolina, which had like almost around 3.8% of adult population. In 2022, Hawaii had nearly 67% of adults who had mental issues, but they were untreated. And this states reported the highest number of untreated mental health patients. This was followed by Georgia and Florida, where almost more than 63% of the mental health cases were untreated. But Vermont had the lowest percentage of untreated mental health patients at around 42.4%. So Vermont, Massachusetts, and Iowa had the best treatment program as the number of untreated mental health patients remained below 45%. Though it's a high figure, but compared to other states, they did pretty well. Alaska and Utah reported the highest number of adults with suicidal thoughts. They had come slightly better health programs compared to other states, while in because in Utah the mental health patients were untreated were nearly 50%, but in Alaska it was comparatively high at 60%. But surprisingly, states like Texas, Florida, and Georgia, who had lower percentage of adult population who reported serious thoughts of suicide, had more percentage of population of adults who were untreated, who were diagnosed with mental health, which is around more than 60%. So for this visualization, the hypothesis that I started was that state with highest rate of adults reporting suicidal thoughts should have better mental health facilities, or they should be treated more on those states as those states are in dire need of such facilities. And the second that I selected for this viz was that states with more robust mental health care system policies and fundings might have a lower rate of untreated mental health patients and suicidal thoughts compared to states with less investments in those areas. This visualization could be helpful for mental health care professionals like psychologists, psychiatrists, therapists, and counselors who can use this data to better understand the prevalence of suicidal thoughts in the respective region or states. It could be helpful for public health officials and policymakers because it will give them a direction in which they should work on. For nonprofit organizations and advocacy groups, for researchers and academics, and for healthcare providers, insurance companies. For the data abstraction part, the data was in form of table which was converted to maps, and the attributes were states, suicidal thoughts, and untreated mental health patient. For the task abstraction, I kind of boiled it down to three tasks. The first one was to identify the states with the highest and lowest percentage of population of adults reporting suicidal thoughts. Task two was to identify the states with highest and lowest percentage of untreated adults with mental illness. And the third one was to summarize the correlation between the population of adults with suicidal thoughts and the population of untreated adults with mental illness in each state. The marks and channels for this one were the points. For the channels for the position, for all the three tasks, the position was used as State is a categorical feature that needs to be represented using positions on the maps. So the second one was the color saturation. The color saturation helped me in identifying the extremes, the outliers in it, and also to summarize the correlation. It helped me in all three of the tasks. So that's it from my side. Thank you for watching.